Ready?
How's it going, everybody? It's Dr. Nick here at Kalkstein Chiropractic, your Baltimore area chiropractor. We're here today with Jayla.
Hi.
Lovely CA, who has wrist pain that's been going on for
A little while.
more than a day. How long? Since college.
Yeah, since college started. I now graduated, so that's
So maybe
helpful.
4 years?
Yeah.
5 years-ish?
Yes.
She played field hockey. She did cheerleading. And she gets in a lot of bar fights.
Not a lot.
Not a lot. Okay.
So, okay.
But I recently did a quick little exam on her wrist, and she has a lot of hypermobility, so she's got a lot of joint crepitus. The carpal bones in her wrist like to bump up against each other a lot.
Sorry. I'm so sorry.
And I wonder why she's got wrist pain. She's
sorry.
always trying to adjust her wrist.
I'm just moving.
So, based on the exam, based on what I'm finding, I do not think Jayla is a very good candidate for manipulation of her wrist. She already moves too much. I'm not going to induce more movement in it. That's just going to make her feel pretty cruddy the rest of the day. So, I think she's short term, especially if she gets in a pinch, if she's being active and she doesn't want to suffer through some of that discomfort. I would recommend she straps or tapes over those carpal bones just to keep everything nice and tight. But ultimately, I want to get her on focused shockwave. I want to get her on laser therapy, help adjust or address some of the pain and discomfort she's getting. But long term is teaching her not to adjust herself so much. But no, strengthen up the muscles that support the wrist. That way we're taking as much pain or stress, I should say, away from the passive tissues being the ligaments of the wrist. Give her a little bit more structure and support. That way she doesn't have pain whenever she does more than one laser a day.
Yeah.
Cool. So we're gonna go start off with focused shockwave. We'll jump to laser and we'll have Carly follow along for the whole thing.
Hey everybody, it's Mike with from Kalkstein Chiropractic. I'm here with Jayla today. We're going to be doing a continued treatment from Dr. Nick's adjustment that he just did, and we're going to be doing some focused shockwave on the wrist here. So Jayla, as you know, we're going to be sitting around 3 or 4 pain or pressure. So just kind of let me know as we start to get into that area there. And why don't you tell everybody just kind of what's been going on with the wrist?
Sometimes I'm having like pain issues with my wrists. Like if I'm doing something too long with my hand, it's causing some discomfort, and I have a tendency, like Dr. Nick said, to self-adjust. I didn't know I was self-adjusting. I thought I was just, shaking out my wrist. It's because it's uncomfortable. That's good, Mike. Maybe a little lower. There we go. Okay, yeah. So I've been self-adjusting, and apparently that's not good, guys. So every time I do that, I try to like shake it out to help it. It doesn't really do anything, so I don't know why I do it, but that's just a habit, and that's something I need to stop.
Yeah, we never want to self-adjust. A lot of times what self-adjusting does is you're just moving the ligaments that are already moving really well, and you're not actually freeing up any space in the areas that you're actually locked up in, which only kind of throws you down a deeper rabbit hole of being a little bit more locked up in that area. So it's best to always avoid those self-adjusts that kind of involve, violent movements like cranking on the wrist, or even the famous chest turn that everybody likes to hit for themselves. So how is this feeling right here? I know you said it was a little bit intense a second ago.
It's still pretty intense. I can feel it in my fingers. But yeah, I'm able to do it. Maybe no more than this though.
Gotcha. And we won't turn it up anymore.
Okay.
We're right at a therapeutic level. A lot of times patients will think that it's a no pain, no gain sort of situation here with a lot of the modalities here in the office. Shockwave, dry needling, even heat and stim, if you would believe it. And that's usually not the case. For focus shockwave, we tell people we want like a 3 or 4 out of 10, but a lot of times we just want it strong but comfortable ultimately.
This is definitely a weird sensation.
Oh yeah, it's even weirder how you don't really feel any contact at all on the skin, minus the applicator actually gliding over it.
You haven't had it yet?
Huh?
You haven't had it yet?
I've had it for like a second in like my elbow just so I could like try to explain it to to the patients, but I haven't had it in an area where I'm slightly injured.
Well, that's our 1,000, which is just kind of the minimum patient, I guess, kind of therapy, if you would say.
No, Jayla is so lucky and so fortunate to get her actual doctor to provide more treatment to her. So Mike, if you
So
just, Mike just finished up focused.
Yes.
It's kind of uncomfortable for Jayla, to be expected. It's a very sensitive area, very sensitive tissue on her right now. But
Yes.
we got a therapeutic dose on her. That's all that matters. And we're gonna follow it up with laser, and hopefully she feels pretty good afterwards.
I hope so too.
Are you ready?
I am ready.
I'm glad you're so excited.
I'm so excited.
It's like one of those big pencils that you got from the bookstore.
Yeah. And
Let me know if it does get too warm, okay?
Okay. Yeah. And we used to try to use those as kids, and our hands were too small for that ginormous pencil.
And the eraser was absolutely terrible.
Yeah.
All right, it's fall time. The air is getting crispy. The leaves are getting even crispier. Scholastic book fair rolls into town. Your mom gives you $20. What are you getting?
I was definitely getting anything fun that I can put in my pencil bag. Or I was getting a pencil bag at that. That's exactly what I've been getting. And of course a book, because my mom would require that I come home with a book. And then I could get something fun. Yeah.
Those scratch and sniff pencils, oh my gosh.
Oh, those?
I like the smelly erasers.
Or the
Yeah, the erasers. Yeah, I had the erasers.
Or the pencils that were like super bendy.
What would you guys say if I was too young to know
To
what
remember.
this is?
You're like, we only have
It's like, I'm kidding.
book fair on
I'm like,
lockdown."
did you just...
Lie? No,
Oh my
I had
gosh.
it. I had it. All the way up until middle school.
If y'all remember the Magic Treehouse books.
Yeah.
Yeah.
I used to rock with Junie B. Jones pretty hard.
Junie B. Jones for sure.
Never read Junie B.
She was a pretty
Flat
cool gal.
Stanley.
You're a boy.
You ever do Flat Stanley?
Yeah, but that wasn't a book for me. I just
I don't
had
know
to
what Flat
a
Stanley
guy.
is.
I don't know what Flat Stanley is. Diary of a Wimpy Kid was my era.
Correct me if I'm wrong, but I'm pretty sure the backstory is that Flat Stanley got ran over by the bus.
Yes.
Yeah.
Sure. And then I said my
pretty dark.
Exactly. A little kid getting ran over by the bus, and he has to live the rest of his life being
But
paper
the
thin.
thing is, you make a Flat Stanley and then you send it to your family or something, and then they go around taking pictures with the Flat Stanley. So his life isn't unhappy. All is fine, I think.
Okay.
Except
I
for the
love
fact that
that.
he got ran over by a bus. Is this okay for you? It's
Yeah.
not too warm.
It's warm. Like lukewarm.
Lukewarm?
Maybe a little warmer.
Maybe a little
than
bit warmer than that. Like hot tub warm, maybe?
Yeah.
Jacuzzi warm?
Definitely not jacuzzi warm. A little less. But it feels nice.
What about the Ripley's Believe It or Not books?
Oh, I had
No.
so many of those. And the Guinness Book of World Records. Whew. And now there's like a Guinness World Record for everything, so those books would be thick.
Yeah.
It's the best because it was like reading, but you would just flip to
It's just
a random
pictures,
page
yeah.
and then read
Definitely.
about random stuff.
Is it really reading, or is it just looking?
It's looking.
I guess it's both.
If
but
you
it's
actually
pictures
wanted
versus
to
words.
read, then you could, but Most people probably did it.
Old school Guinness books didn't have pictures, I don't think.
They just said
definitely
the
did.
words?
No, they
I
definitely
was
did.
supposed to say, that's pretty sad.
Just, don't you dare spread misinformation. They definitely had photos.
Okay.
You're done. How'd it feel?
It felt good. I like this better than the fucking Shockwave. But yeah, it felt
That's why
nice.
you're getting both. It's like a little treat afterwards.
Yes. A little spot treatment.
Guys, if you have any questions on any of the modalities we had, but more importantly about wrist pain, causation, feel free to leave questions down in the comments below, and Jayla herself will actually answer those.
It will be me.
Because she's a professional.
It will be me.
And
I know
we
everything now.
trust in Jayla's
Judgment.
professional opinion.
I can do it.
We'll see you in the next one, guys. If you're reading this, it means I didn't make it. For Carly, it's her, not Carly, Carly's the lady behind the camera for Jayla. It's warm, someone just used it.
I'm using, oh, okay.
What?
Getting seconds, the laser.
Seconds?
Yeah.
It's part of the treatment plan we discussed.
Yeah, some leftovers. This machine takes very long to turn on, so.
Is this thing on?
No, it's not.
It's starting to boot up.
Still takes a very long time.
We're just waiting.
Just sitting here. You seen that song? Not seen it, heard that song?
Heard that song.
Coulter Wall?
Don't know who that is.
It's a new trend.
I don't know what that is. Everyone with their glasses. You look super cool, guys.
Do we though?
Very cool. I think we do.
Humana.
You're all mine. Gotcha. Let's get her a pillow under her arm. That way she just won't have to hold it the whole time, you know what I mean? Sure. You know what I mean? Let's save our own backs here.
Thanks. Wait, what?
I'm gonna
Oh,
lift you up so that way Mike can just be right at
nice.
level with you. Save his back, save your back, save all our backs.
So kind.
Nice.
Are we already filming?
Yeah.
Oh, well, I had no idea about that.
My wrist gets really tired, then I'll go like this, or like I'll try to shake it out if I feel tired. Like I just did it, or like that movement, and then it cracks. Yeah. So.
Do we buy it?
I don't know there's nothing that's happened, but